also it's a day we do our domestic chores. But whatever thing you have set out to do today, being Saturday, I hope you know that you're able to do it because you're healthy, you're well and alive. All right. And that's why we'll bring you Health Talk with Bibi this Saturday morning, because we believe that health is wealth. So if you're unhealthy, if you're sick, I know you will not engage in any of these businesses. You will not do what you want to do at all. And now, we have an interesting topic to talk about this morning, but I do hope you are alive and well. I do hope you're good. I do hope you're strong, because I am. And here at VOP, we are all fine and well. All right, it's Saturday morning. It's Health Talk with Bibi. My name is Biblas, but you can call me Bibi. And it's Health Talk with Bibi this morning. And today, I'll be talking about HIV. Yes, HIV. I know you've heard about it. Obviously, we've heard about it. A lot of people know a lot about it. But we know that there are a lot of misconceptions about HIV. So today, we are going to clear you about whatever thing you have as misconception about HIV. And I'm not doing this alone, because you know I am not a medical expert. And I have someone here in the studio, Dr. Afia Mekom. Good morning, Dr. Afia Mekom.
Good morning, Bibi.
How are you doing this morning?
I'm fine, thank you.
All right. Dr. Afia Mekom is currently working with Nigeria Air Force Hospital. Am I right?
Yes, you're right.
All right. So if you want to see in fact, not just beautiful Dr. Afia Mekom's face, do join us on our YouTube channel rather, at Voice of the People 90.3 FM. So you go check her out. She is very beautiful. You already know how I look like, so you don't need to see me.
Thank you.
So please join us on our YouTube channel, because we are currently streaming online. All right, you're welcome to the studio, Dr. Afia.
Thank you very much.
Just like I said earlier, there are lots and lots of misconceptions about HIV. So I want to ask, to start with, is HIV and AIDS the same thing? Because sometimes, personally, I see myself saying HIV and I also say AIDS at the same time. Yeah. So are there differences, or are they the same?
Okay, HIV is different from AIDS. So when you say somebody has HIV, that means the person has the virus, because HIV is human immunodeficiency virus. So that means the person is infected with the virus. But when someone has AIDS, that means there is some form of immunosuppression. So the virus is affecting the immune system in such a way that the person's immune system is not able to perform its normal function. So someone can have both HIV and AIDS, as HIV leads to AIDS, but someone can have HIV without having AIDS. I hope it's clear.
I do hope it's clear. I do hope it's clear. All right, I'll be opening our phone lines now in case you have any questions to ask Dr. Afia. She is here to clear you. The number to call is 0700 903 903 903. 0700 903 903 903. All right, Dr. Afia. Another question I want to ask is, can HIV live outside the body? Because there's this trending news recently about during Nedu Wazobia's talk on the radio. Mm-hmm. A woman called in. They call it, frankly speaking, something that bothers you. If you have something that bothers you, you can call into the program and talk about it. Right. So a woman called in. All right, let me take this call before we continue. Hello, beautiful morning to you. Good morning. What's your name and where are you calling us from? Hello. Hello, good morning.
Hello.
Good morning, beautiful morning to you. I can hear you now. What's your name and where are you calling us from?
This is Eric from Oba.
All right, Eric from Oba, you're welcome to the show. We're talking about HIV. What's your question?
Okay, good morning, doctor.
Thank you. Good morning.
Please, I want to find out if it can be possible for someone to have HIV without having AIDS. Is it possible, or must one have the two? Once one have HIV, the person automatically have AIDS? I want to know, please. Thank you.
All right, thank you very much, Eric from Oba. Dr. Afia will respond to your question. All right, Doc, do answer his questions before I ask mine.
All right. So someone can have HIV without having AIDS. So for example, now someone is exposed to the virus and gets infected today and now has HIV. So it takes a period of time when the virus breaks down your immune system, because it affects the parts of your body that helps you fight against diseases. So as it continues to affect your immune system, it can now lead to AIDS when it overpowers your immune system. So yes, one can have HIV but not have AIDS.
All right.
Yes.
I hope, Erica, I do hope you're cleared now.
Yeah.
All right. I was about asking. We have another call. Hello. Good morning to you. Hello. All right. We lost it. Do call us. The number to call is 0700 903 903 903. All right, Doc. The woman said that she will inject herself and extract blood from her body,
Okay.
and now put it in the Zobo drink that she's selling, because she believes that she doesn't want to die alone. She wants others to join her and die. So she will extract the blood from her body, now inject it into the Zobo container that she's selling or producing. Wow. Then people will take and drink. Now, assuming someone takes such a thing, is it posing a risk for that person?
Okay. So basically, HIV does not live outside the body because the virus needs a cell in the body that's alive to function. So if you take out your blood and you put it on the table, the virus is going to die.
Immediately?
Yes, it's going to die within several hours or less.
Okay.
So it cannot. So what she was doing, whoever is drinking the Zobo is not at risk of HIV. No, it's not.
But
it doesn't live outside
the person
virus.
might likely contract other diseases.
Well, possibly, yes. You can have some gastroenteritis from that, but not HIV.
All right, let's take this call. Hello, good morning to you. Hello.
Hello, good morning.
Beautiful. All right.
Please, doctor, I understand your explanation, but I just want to find out now. If it's possible for one to have HIV without having AIDS, what can lead to someone having HIV without having AIDS? Because I know that the normal way someone can contact AIDS is through sexual intercourse. That's the one that is most rampant. So how is it possible that someone can have HIV without having AIDS? What can cause it?
Okay, Dr. Afia, you got what he asked.
Yes, I think.
All right.
So the thing is that when people would have, that's why we advocate for you to check, so you go and check if you have HIV, so you would know your status first of all. Now, when someone knows that, okay, I have HIV and you are placed on medication, if a person that is placed on medication continues to take their medication faithfully so that the viral load is low and all of that, it would prevent the person from having AIDS. So taking the medication, healthy lifestyles, all of that is geared towards preventing someone that has HIV from progressing to AIDS.
All right, you said something, the viral load being low, right?
Yes.
If you're taking your medications.
Yes.
Now I ask, if it's low, can you infect someone?
When the viral load is low, the infectivity is reduced as well.
So it's likely that you're not going to infect someone?
It's likely, but I would not rely on that because the person still has the HIV virus. It's still present in the person's system. It is just low so that it doesn't affect the immune system very well. So the infectivity is low as well, but the person can still transmit the virus.
All right.
Yes.
I do hope Eric from Mobile is cleared. All right. I know that we all know the activities that are likely to transmit HIV, especially the main ones. But now let me give it to Dr. Afia to answer that question. Which activities are most likely to transmit HIV?
Okay, so the main one that most of us know about is the sexual route. So when people have intercourse with other people that have the virus, it's a very high possibility for them to contract it. So especially it's seen that is higher when men have intercourse with men as well. But then intercourse is the main route of transmission. It can also be transmitted by sharing of sharp objects to those who are intravenous drug users who share needles. That as well can be seen. And then it can be transmitted vertically from a mother to her child.
All right, let's take this call before we continue. Hello, beautiful morning to you.
Hello, good morning.
Good morning. What's your name and where are you calling us from?
This is Awaja.
Sorry, I didn't get your name.
This is from Aja.
Okay. Let's hear your question. Dr. Afia is here already.
Hello.
Hello, we can hear you. Your question.
I just want to ask doctor, what is the main cause of HIV? What drugs HIV is dead?
Sorry, we didn't get your question.
what is the main cause of HIV?
Okay, the main cause of HIV. What brought it into the world? All right. Thank you very much, Dr. Afia will react to that. It's quite funny, but he wants to know. And I think I want to know too.
Okay. So it said that there was some mutation first from some certain species of apes, and then human beings got in contact with those animals and they got the virus. However, what it is right now is that we have the virus amongst us. So however it came to be, it is here now. So our main focus is to find out how to work towards achieving less people contracting the virus, and then those that have the virus to have access to treatment, and proper health.
All right, let's go on a short break. We'll be right back. Do not go anywhere. Welcome back to Still Health Talk with BB this morning, and we're doing HIV today with Dr. Afia Mekom. So if you're just joining us, I can tell you you're not late because we're still starting. All right, doctor, welcome back. I want to ask, just like every other illness, every other diseases that comes with a lot of symptoms, I want to know, what are the symptoms of HIV?
Okay, so the thing with HIV is that the symptoms are not very specific. Unlike malaria, where you say, okay, you have headache, chills, joint pains, and maybe bitter taste in your mouth, you would know when you have malaria. But the thing with HIV is that it's not very specific, because HIV virus attacks the immune system. So for some people, they might have a period of malaise. Usually after infection, there's a period where there will be, you feel maybe as if you have malaria, body pains, there might be vomiting, there might be just a period of unwellness, and then after that there is a latent phase where you feel nothing, you feel fine, you're walking around, you're okay. So that is why HIV they show for face, because
honestly they show for face.
Exactly. So the symptoms are not very specific. That is why we're having on people being tested to know their status.
All right, talking about testing, how often should we get tested?
Well, adequately, you can get tested every 6 months, because if, for example, someone gets infected with virus today, it might not really show in the blood until 6 months later. So every 6 months is fine to get tested, especially if you're exposed.
Okay, let's take this call. Hello, good morning to you.
Hello, good morning.
Beautiful morning to you. What's your name and where are you calling us from?
This is Enina from Alakoko.
All right, Enyinaya, let's hear your question.
Good morning, doctor.
Good morning.
Yeah, please, doctor. I had this friend of mine. One time ago, he went to the hospital. He was very sick. And when he went to the hospital, he was told that he had HIV-1, that the immune system is very weak. And he said that the doctor said it was as a result of accumulated drugs that he took. Because my friend used to take both native and orthodox drugs at the same time. So we were arguing it, say, how can drugs, accumulated drugs in somebody's body, or lead to HIV? So I want to know, is it really possible that there's a period that the kind of drugs that one can take and it can lead to HIV-1? That's my question. Thank you.
All right, thank you very much, Dr. Afia.
Well, I don't think that's correct. No, that's not correct, because HIV is only transmitted from someone who has the virus to another person. So if that your friend has been taking a lot of medications and all of that, that would not cause HIV. It might cause something else, but definitely not HIV, because it is clear for HIV. The route of transmission is from one person who has the virus to another. That is it.
All right. The number to call is 0700 903 903 903. 0700 903 903 903. This is the time to share your concerns so that Dr. Afia here will react to your questions or misconceptions. All right, doctor. Sometimes one will go to the clinic and get tested, and they will tell you you don't have HIV. You can't be seen. They will tell you to come back after 6 months, and after 6 months it will start showing. Why?
Okay, so the thing is that when the virus gets into the person's body, the body has to, the test that we usually do, check for antibodies. So what's an antibodies?
All right, sorry, let's take this call.
Right.
Hello, good morning to you.
Hello, good morning.
Please turn down the volume on your radio set so we can hear you clearly. Good morning.
Good morning.
All right, let's hear you.
My name is Olamatu. I'm calling from Nobalimbi.
All right, Olamatu, let's hear you.
Okay, is it possible that someone has HIV and you slept with the person? Is it possible you must contact it?
All right, thank you very much. Do you have any other question?
Yes, and secondly, a friend of mine, his wife is pregnant, and the friend of mine is having HIV positive, and the wife is HIV negative when he's tested. I don't know how, whether there is any misunderstanding, I don't know. Yeah.
All right, thank you.
All right, thank you.
Okay, Dr. Afia will react to your question. All right, Dr. Afia, the first one is said, if you had intercourse with someone who has HIV, is it possible you contact it?
Well, it's possible that a person would contract it, and it's also possible that the person would not contract the virus.
Really?
Yes, apparently there's a percentage of the population that have a certain kind of mutation in their gene that they cannot have HIV.
Even though
they are exposed to the virus. Yes, there's research on that. Yeah,
okay.
So it's possible. However, well, it's better to be safe than sorry.
than using yourself to try out,
exactly.
to experiment. So it's better to be safe.
Yeah.
So it's better to protect yourself. All right, the second question, that the husband is positive, the wife is negative, and is pregnant.
Okay, so for this case as well, like we mentioned earlier, if someone that has HIV is on their drugs and the viral load has been reduced, infectivity is reduced as well. So it's possible that he's not transmitting the virus to his wife. So he's taking the medication as well.
And getting the wife pregnant, what about the baby? Isn't the baby at risk?
The baby is at risk. So we have protocols in the hospital where we try to ensure that the baby is not infected with the virus when the baby is delivered. Yes.
And I have a friend also, let me ask like my listeners, I have a friend also who is positive and the husband is positive, but they gave birth to a negative baby.
Yes.
How is that possible?
It's possible. So when the baby is formed and the baby is growing in the mother's belly, the baby is protected from the virus. The point where we are worried...
But the baby is a product of both the mother and the father.
Yes.
You understand? Something coming together to form the baby.
Yes.
So is that thing not infected?
No, it's not.
Really?
It's not infected, yes. There are many people who are positive that have given birth to negative babies and they are fine. Yes. So that is it. The only time where we're worried is when the baby is being delivered.
Okay.
So after the baby is delivered, we put the baby on some medication for some period of time to ensure that the baby doesn't get infected, and then we do some counseling to the mother as well so that the baby is not infected. So it's very possible that many people who have HIV and have negative babies, healthy babies. Yes.
Wow.
Yes.
Obviously, if you have HIV, that shows it is not a death sentence.
Definitely not.
You have your life to live and enjoy. All right, doctor, but we're not encouraging that you go contract the virus.
Yes.
Please protect yourself as much as you can. Let's talk about the preventive measures of HIV.
Okay, so for prevention now, it's first of all, like we have said many times, you have to make sure that you check your status so that you know where you stand. So looking at the means of transmission, you have to make sure that it prevents unsafe sex practices. So either you A, abstain, you B, be faithful to your partner, and or C, you use a condom. So condoms help to prevent that.
So have the
as well.
ABC.
Yes.
Okay.
The ABC of prevention.
All right.
And then for those who use intravenous drugs, you have to make sure that, well, it's not good to use intravenous drugs either ways, but not to share sharp objects basically with other people because there's some transmission as well. Then if someone has a pregnant woman now and she's HIV positive, she should go to the hospital and trust the healthcare workers with the information. You know, some people are not very secretive about it. They don't want to talk. Yes, so just go to the hospital where health professionals, confide in them, and they will be the ones to guide her on how to prevent transmission to her unborn child.
All right, doctor. Thank you very much.
You're welcome.
Now talking about, because I've seen a lot of people who are on medication, antiretroviral drugs, right?
Yes.
And they eat certain kind of foods.
Yeah.
So are there certain kind of foods that one should avoid and one should eat?
Well, basically, we advocate for you to eat healthy diets, to avoid smoking, avoid alcohol. Just
all right, let's take this last call, please. Hello, good morning to you. Hello.
Good morning.
Good morning to you. What's your name and where are you calling us from?
Sunday, Magege.
All right, Sunday, let's hear you.
Okay, doctor, good morning. I beg you. I want, since you say, you mentioned condom, say, if you protect person, how safe that condom be? Because some people, they talk, say, condom no 2 days safe. They think the virus will pass enter another person's body. So I want to know that condom, is they 100% safe when person use them? I mean, know they're 100% safe.
All right, thank you. Doctor, in placement for the word he used, we rather use barrier method.
Yeah.
Let's go.
Okay, so for barrier methods of contraception, it's not 100% safe, no, but it has been seen to help as opposed to not using anything and just going either way. So like I said, ABC is in that order.
Yes.
Either you abstain or you be faithful to one partner, or if you're using such barrier method, you have to make sure that it's good quality so it doesn't burst or it doesn't break. And it's not 100% no.
All right, let's go back to the food to take and food not to take.
Okay, so yes, for the food to take and food not to take, basically healthy diet. So a balanced diet mixed with
fruits, vegetables.
Yes.
We should go green.
Well, with some carbs as well, but healthy diet, and then to avoid smoking and too much alcohol intake as well.
All right. I do hope you've heard Dr. Afia explain this properly. Thank you so much, Dr. Afia, for coming into the show. It's a pity we just have 30 minutes to do this. All right. So if you want to get to Dr. Afia, if you have more questions you don't want to ask on the radio and you want to contact Dr. Afia, do well to call me personally. Do well to send me a text and I will, or rather, send to our studio line and I will get through to Dr. Afia. That's how we come to the end of the show this morning. Although our health talk show, the time has been changed from 9:30 a.m. to 10:30 a.m. So have it in mind and keep a date with us every Saturday at 10:30 a.m. for your health talk show with Bibi. All right, we'll have other programs coming up. We'll have Business Roundtable and Business Launchpad, respectively, with Peter and Nosike. And we have our world news coming at 12 noon. So do stay